Hello, and welcome to the Thyroid Warrior podcast. I'm Ebony, and I'm here as your wellness facilitator. I'm going to be sharing my experiences in managing Hashimoto's disease, and I really hope that it'll help you on your personal journey. Keep in mind, however, this does not substitute as medical advice. It is only for your information and motivational purposes only. Now, let's get started. Hello, friends. I am very ready to do a deep dive into talking all about health literacy. Now, I want to set the stage for you to begin this conversation because it is a very important one. So previously, we started talking about the 21st Century Cures Act and how that really and truly gives us as patients the ability to start the process of taking control of our health information. After that, I started talking about patient advocacy. And a part of patient advocacy and speaking up for ourselves also includes being able to actually understand and use the information that is being given to us. So now I want to start diving deep into some concepts related to health literacy, also scratching the surface or starting the process of talking about just different barriers and social determinants of health and how all of that comes together. And then I also want to talk about things like limited English proficiency, because that is a real thing. And I want to give you the tools and the resources to be able to just understand what these things mean, because in a lot of cases, they can be perceived as buzzwords, and many of us know all too well that that isn't necessarily the case. And I also want to try to get a very special guest to talk about trauma-informed care, because the exact same thing is happening with that as well. So we're going to start today off by talking about health literacy, defining it, and really talking about how that can impact us from the perspective of accessing care. So what is health literacy? What does that even mean? And how do we even work on achieving this? And is that even a thing? So by definition, and I want you to be able to head over to the Health Resources and Services Administration, HRSA.gov. Also, the CDC has information on health literacy, as well as NIH, and I will link all of those in the show notes as well. However, the definition of health literacy, according to the HRSA, is the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. So I think we all have been in a situation where you go to the doctor and they tell you something and you're like, I don't even know what that means. Well, I'm sorry. Come again? What? I have Hashi who? What? And it takes me back to when I initially got diagnosed. The endocrinologist came in, yep, textbook Hashimoto's, walks out. Y'all, no, I did not understand what that was. I hadn't taken anatomy and physiology yet, so I didn't even understand where my thyroid gland was. And it was just hard, because here I am experiencing all of these things with my body and not understanding why they're happening. And then I have a doctor come in and just sputter off something. He did not tell me how to process that information, how to understand it, what to do, what were my next steps, nothing. So naturally, I have told you guys about how I completely blew up during that appointment. But when you go for so long without being diagnosed, and when you have someone that doesn't even give you the respect of having a decent conversation as a human being, not as a patient, not as me thinking that I'm better than you or I know more than you or they're their little patient. Here's the information that you have waited for many, many years to find out. And now you're going to look at me as if I am the best thing ever because I gave you this diagnosis. And then I walked out. Yeah, no. So what I want you to think about when you got diagnosed or when your loved one was diagnosed with their thyroid disease, or honestly, any health condition. We can really and truly expand this scope because, as many of you know, when you're diagnosed with one autoimmune condition, it's not necessarily too far behind where you may be diagnosed with something else, or you may have been impacted by something completely different. And just like I said, a loved one may have experienced the same thing. Now, imagine how you felt in that moment. Imagine how your loved one felt in that moment. And that is why I want to start having these conversations about how do we change the conversation when we are at the doctor's office and when we're talking through these things. So, and also, if you have someone that is elderly, if you have someone where English isn't their first language, from a cultural perspective, from an economic or educational perspective, there are so many barriers that can impact someone's ability to understand information, especially when it even comes to filling out forms. And I am very verbal with many of the groups that I am associated with on making sure that people know what to do. That is why training is so important to me, because you can say something to me, but if you don't check for my understanding, I'm kind of screwed. And I can unfortunately end up doing more harm than good. And also, if I'm not spoken to in a way that works for me, then I'm also not going to follow your instructions, because depending on my cultural background, depending on my experiences, that's going to shape how I receive information and how I communicate. And one of the things that we are working on at my organization is, how do we talk to patients? How do we relay information to them? And what I would challenge you with is not asking, but telling your provider, how do you prefer to be communicated with? How do you learn? How do you take in information that's hard? Because at this point, many of us have unfortunately encountered really bad experiences with that, but also some good, I hope. For example, for me, I am very data driven. So I tell my doctor, here are all the things that I have done. This is what I'm seeing based upon my most recent lab values. I've trended this. It looks good or bad. What do you think? The reason why I'm coming to you to ask of your opinion is because I respect your opinion, but also because I don't want to turn to Dr. Google to get my information. So I am trying to go over the information so that I can understand it, so that I can help myself. I also prefer to both have you explain things to me, but I also need to read things. I'm not as big as of a video person unless I need to do something. So that's what I mean. So to recap, when I'm talking to my doctor, I say I'm a very data-driven person. I prefer to receive information via a verbal conversation and also by reading. Video, unless I have a procedure coming and I need to do something, doesn't necessarily do it for me. And I would really appreciate it if you could also record this in my chart. That way, it gives other providers that read my chart information about how to best communicate with me. For you, you may need to hear it, have someone present you with written documentation, and to have a video. All of those things are perfectly okay to request. There's nothing wrong with that. And if that is something that is going to help you better understand what's happening, go for it. And there are resources that can be given to you to explain those things. Aunt Bertha is another website that is also a really good resource for people, and I highly recommend it. So if you have a loved one and you see that they're struggling, you see that they don't understand, see if it's a way for you to be invited to that person's healthcare visit. Or, because we are now in the age of telemedicine, determine if there is a way for you to be invited into that meeting when you are there with a loved one. And let's say you're in different states, which is actually something that I do with my mom. Either we will have an actual virtual visit together, or she has given permission, or she requested to have me be in the appointment with her by having me on the telephone on speaker, so that if she has a question, she can ask me. And also, I know the types of things to ask the doctor, so I'm able to do that. And even when my sister-in-law just had surgery not too long ago, as it relates to the recovery process, I was texting my brother different questions so that he could then ask the doctor. And I said, if there is something that you don't understand that the nurse is telling you, ask them to explain it to you in a different way or to give you an example. And they have to do that. And if there are instances where you are seeing that healthcare provider isn't able to do that for you, make a request to say, I have asked you to explain this to me in a way that I can understand, and you did not do that. I would like for you to record that in my chart. Or say, I would like for you to record in my chart the different resources that I have requested to dig deeper into whatever concept that you need to review, so that I can get it printed on my after visit summary, or because of the 21st Century Cures Act, I can see that in your notes so that I have a way to go back and look at it. Those things are perfectly acceptable. And also, don't be afraid to get straight to the point. Just say, look, I need you to give it to me straight. I don't need you to beat around the bush. I don't need you to try to find fancy, flowery language. And I don't need you to use really big words. Tell me what I need to know in simple and plain language. The same is true from a writing perspective. Write/speak to me as if I'm a third grader. I don't care how intelligent you are. You need things in plain language sometimes, because you can have 1,000,001 appointment. Your children can have 1,000,001 appointments. Your loved ones, your parents can have 1,000,000 appointments. And that becomes difficult to keep up with over time. And I'm currently going through that right now, even with my mom, trying to figure out, okay, she didn't include me in that last appointment. Now I'm a little confused. And now I'm trying to backtrack and say, all right, where's your patient portal? Let me go look it up. Did you make sure you documented that I was your healthcare proxy so that I can have access to this information? No? Okay, I need you to fill out the release form so that you can do this, so that I have the ability to walk through this with you so that we can go through the questions. And finally, what's really important is to understand that each of us brings our own culture to the conversation when it comes to interacting with health professionals. So it's really important to make sure that your healthcare team understands how you, from a cultural perspective, receives information, receives treatment, what options you have. All of that's important to your care. And if it means that you have to bring in information to help your care team understand that, that's totally acceptable as well. And what I would recommend in that case is to bring a pamphlet, bring a document, bring something that you printed out, and ask them to scan that into your chart for review so that they can have an understanding of how you need to be communicated with, what's customary for you if you have surgery or a procedure, or even if someone passes away. I know there are different customs that need to be followed in that case. Does your hospital or clinic know about those things? Do they know about whether or not you can receive blood products or blood? All of that is very, very important to you as the individual, and that needs to be documented somewhere. So, just to recap, we want to be able to understand the information that is being given to us from a health perspective. We need to be able to factor in what each of us brings to the conversation and how to best communicate with your care team. And we need to understand as well that sometimes we have cultural differences that will have an impact on how we receive care, and also understanding the best way to give and receive information, and whether it is reading, viewing something, or hearing it. So that is what I'm going to contain in today's episode. Next week, we're going to actually talk about something called limited English proficiency, because that's important. And while that may not necessarily be something that I have to factor in, it's very important for a lot of people. And I want to make sure you have access to that. So with that, friends, let me know if you have any questions, comments, or concerns. And as a note, if you do want to email me, my email address has changed. So that email address is joyfulebony@gmail.com. And I look forward to hearing from you. And with that, next episode, we're diving deep. Okay, thyroid warriors, get out there and take things one step at a time. Remember, reflect on your triumphs, know that you are doing your best, and do what you need to do in order to be well. I would absolutely love it if you subscribe to this podcast and share this episode with a friend. And don't forget, leave me a review. I read those and try very hard to improve the show based upon your feedback. So I'd love to hear from you. And with that, be happy, be whole, and be well. Take care.